4 o'clock, everyone. The St. Mary's Legacy Clinic, a mobile medical clinic operated by the Diocese of Knoxville, will soon be marking its 5th anniversary. And here now in the studio to tell us much more, we have Sister Mariana Kuntz, the director of the clinic. Thank you so much for coming in.
Thank you for having me.
You guys do so much good all throughout East Tennessee. For people who are not familiar with the clinic, explain exactly what you guys do.
We try to be a primary care office on wheels, treating mainly adults 19 to 64, offering basic preventive services, ongoing chronic health and disease management services, physicals, and to be a primary medical home for our patients.
So you get to know your patients pretty well because you see them on a regular basis.
Right. We have some patients who have been with us the whole 5 years. Others we say have graduated. Either they've gotten health insurance or been able to move on to fixed clinics. But we do develop long-lasting relationships with many of our patients.
So you guys have been serving our community now for 5 years, coming up on the big anniversary. At the same time, St. Mary's is closing.
Right.
Does that have any impact on what you're doing?
It doesn't change what we do, but the message we want people to know is that we are still continuing on, that we were instituted to be the legacy of St. Mary's Hospital, to continue that service to the poor of East Tennessee, which is what St. Mary's was known for, compassionate care for people who cannot afford to buy health care and don't have insurance.
And you will still be here through all of this. You want to make sure that everyone at home knows that, because they rely on you and they need these services.
Right.
But to have these services, I understand you guys need a lot of volunteers. People who are watching right now, how do they get involved?
Our website is the best location to get information about our travel schedule, what it takes to be a volunteer. We do have an orientation coming up at the end of January, January 30th, so now's a good time to get involved if people are interested. stmaryclinic.org. And that is the best way you can contact us through that website.
Oh, so I have no medical background, but if I wanted to spend some of my time helping out, are there things that someone like myself could do?
Absolutely. We have general volunteers, people who just have a good heart and want to help, people who can just smile and make patients feel welcome, who can have a little bit of facility with computers, put data information into the computers. We also have an increasing number of jobs for people who would like to work at our office. Maybe they can't travel out to a site and spend all day at a site, but they have a few hours every week or a couple of hours a month and would like to work at our office and main administrative home. We also have that need as well.
Your home base is here in Knoxville, correct?
Right.
But how far do you guys actually travel here in our area?
Most of our sites are an hour to an hour and a half drive away.
Wow.
We're out 7 days a month to 6 different sites. One site we double up on, and the rest are 1 day a month. So 7 days a month total.
All right. And anything else you want people to know about your clinic?
We are really changing people's lives. We are having an impact. We know this. People are changing their health habits because of us. They're losing weight. They're getting their diabetes under control. They're getting their blood pressure under control. And we know that when people do those things, they reduce their risk of having catastrophic health events. And so we know that we are impacting the health of our neighbors in East Tennessee.
You definitely are making a huge difference, and what a way to carry on the legacy of St. Mary's.
Thank you.
Sister, thank you so much for all you do.
Thank you for having me. I appreciate it.
Glad to have you on. Lori?